Hi, I'm Dr. Kelly Miller, and today I'm going to be speaking to you about andropause. You might be thinking, what the heck is andropause? Andropause is the male counterpart to menopause in women. Yes, we men have hormonal issues just like our female counterparts. The usual age for men noticing changes, problems, is usually 45 or 50 years, but it can occur much earlier. You know, our testosterone levels drop about 10% every decade after age 25. So what are the symptoms of andropause? The following are some of the most common: erectile dysfunction, night sweats, muscle loss, low libido or sex drive, depression, weight gain around the middle, urinary problems, hot flashes, development of breasts, body hair loss, sleep apnea, fatigue, and irritability. You know, there are several hormonal imbalances that can create these symptoms, but the most common is a general drop in the testosterone and an increase of conversion of testosterone to estrogen, either in the form of E1 estrone or E2 estradiol, through a process called aromatization. Yes, men, we have estrogen in our body, and we can get too much estrogen in our body. In fact, the average 50-year-old man has more estrogen than his counterpart 50-year-old wife. These hormonal changes and imbalances can be life-threatening. A man that has lost 50% of his testosterone, coupled with an increased weight gain in the middle, is twice as likely to have a heart attack. We now know there are hormone receptor sites in the brain, the bones, the heart, the lungs, the digestive tract, and the blood vessels. Significant changes in our hormonal levels have a direct adverse effect on all these organs. Significant changes affect our confidence, our clarity of thought, our muscular strength, our cardiovascular health, and our libido. We also now know that men have estrogen receptor sites in the prostate. Excess conversion of testosterone to estrogen causes overstimulation of these prostate receptor sites, which leads to chronic inflammation and even prostate cancer. Synthetic prescriptions for testosterone are not the answer. This synthetic form of testosterone is an extraterrestrial compound that will create adverse side effects over time. It will not be long before there are numerous published studies on the increased prostate cancer rates of these synthetic testosterone users. Be forewarned. Nor does a synthetic testosterone deal with the conversion of testosterone to estrogen through the aromatase enzyme. So what's the solution? The absolute best way to evaluate your hormones is through saliva testing. We take 5 samples of saliva throughout the day to ensure optimal test results. Once this data is obtained, a specific plan for you can be implemented using non-prescriptive bioidentical plant extracts that will correctly fix the imbalance deficiency, restore hormone levels to a more youthful and healthful state. So not only will this treatment help correct the negative symptoms of erectile dysfunction, night sweats, muscle loss, loss of libido or sex drive, depression, weight gain, urinary problems, hot flashes, breast development, fatigue, and irritability, it will have a synergistic positive effect on your concentration, your confidence, your muscular strength and size, your skin, cardiovascular, digestive, and bone health.